My name is Sandra Oliver. I am the site manager at Pinelands EMS vaccine site. So today I'm quite excited. We've got quite a number of people here today that was drove in by the buses, so that made us very excited to have so many faces and knowing that we will jab such a lot of people today, so I'm quite excited for that.
I'm Dr. Reno Morar. I'm the Chief Operating Officer at the University of Cape Town. We had a slow turnout. We started yesterday, Monday the 2nd of August, and we arranged with the Provincial Department of Health to have our staff come on Monday the 2nd and Tuesday the 3rd. I heard from colleagues here at the site that in the first hour and a half we already had about 170 staff, which is absolutely fantastic. And we want to encourage all our staff and students, when our students become eligible, the under 35s, to also make themselves available and come and be vaccinated.
My name is Ntabiseng Steerman. I work for finance. Since we actually work with students, we actually interact with a lot of customers, parents, even plus the students as well. So I think it is actually very important for me, because I think it's going to be less chances to infect maybe my colleagues, even maybe the visitors that actually come to our office as well.
I am Candice Dykes and I am an administrator at the UCT Medical Campus. So yeah, I mean, you hear stories and you watch videos about people having strange reactions, but I think if you just look at the number of people that are dying, and when you're faced with that every day, the choice is really simple. So I'm very happy to be here today.
My name is David Kitsia. I'm a public health specialist. Well, we are learning that there's a lot of fake news going about, and a lot of people saying you get COVID once you get the vaccine, and this is often people who have or were incubating COVID already when they went for the vaccine, and that's why we're particularly careful about asking people about signs and symptoms to make sure that they are not incubating COVID when they get the vaccine. The vaccine is very effective against getting severe disease and against hospitalization and ICU and against death. That is where the vaccine really works very well.
You know, the patience that we have and the fact that this is such a historical event for all of us, because we've lost so much with this pandemic, and here we have opportunity to change future. A lot of people come in here, they are quite anxious, not sure what to expect, and when they get here and they see us and the way we interact, people come here and they get that, you know, that love, happy to see them, and all the anxiety disappear, because that is what we want, because people is quite nervous about getting the vaccine, but here we just want to put your mind at ease and say you're doing it for yourself, for your family, you know. Only way we can change the pandemic if we get vaccinated.
We believe that vaccinating our population, our community, our South African community in general, will contribute to a strength of having a population immunity. It's known as population immunity, so that as many people can be vaccinated as possible, so that we can reduce the impact of the infection on our staff and students and our broader community.